sir. Welcome to the BW Healthcare Summit and Awards. So, my first question to you is uh, how, as a nation, can we improve the cancer situation in our country? Uh, the rampant number of cases holistically, not only specific cancer, which not only skin cancer or lung cancer, but there are many other kinds of cancer. How, as a nation, can we improve on this?
So thank you for having me. So I think let's divide this question into two parts. One, the prevention and early detection. Let's keep that as one part, and the second part is as a treatment part. So for a prevention and early detection, I think this will require a lot of public health measures, and I think a lot of government efforts have to go into it. Uh, a government can partner with people like us, or I'm sure there are uh, better qualified, people who are much better at public policies, who can help us define this prevention and early detection part. Because a lot comes into it when you're making a policy, the cost of it, the application of it, the spread of it, and I think that is an essential piece which should be taken care of in terms of detecting the cancers at an early stage. Most of the Indian cancers, whichever we have, be it be oral or a breast or most of the cancers, they are detected at a later stage as compared to the Western countries, and that's essentially because the education and the detection modalities are obviously there's a certain lack in that. Coming to the second part of it, the treatment part of it, which is where a public-private partnership can come in, and at present I think we still are on a very hub and spoke model in which a lot of treatment modalities are still centered around the main cities, and patients have to travel. I do agree that with the growing number of professionals coming in, it's spreading out more and more. But what still needs to happen is a lot of public education has to go about that if somebody has a cancer, it is not a death sentence. The systemic therapies, the surgeries, and the radiation, the modalities have to be thought of and taught of. I still believe at this point that I come from a small town in Haryana, and I still believe that somebody, when they get a cancer there, for them it's a doom, and for me it's a normal daily conversation. So the gap is pretty huge in terms of the patient information and the doctor information, and I think that has to be dispersed in the right way. So I come from a place where it's more of a private work. But then how do you democratize that? How do you spread it out? And how do you apply it for a wider public use?
Yes.
I think that's where a real entrepreneurship will come in. And I'll probably call up anybody who has better ideas, come and partner with us. And I think as a social initiative, I'm sure most of me and my peers will be more than happy to take part in that.
So, my second and last question. Where do you think our oncology segment in our country is going with technology? Which direction is it going with technology, with artificial intelligence, and now there are robotic surgeries? So, what would you like to say about that?
So let me divide the oncology practice into two parts. One is the clinical part to it,
Yes, sir.
and the second is the research part to it. And I think as far as the clinical part of it is concerned, be it the surgical, the radiation, or the medical, I think we are pretty head to head, or shoulder to shoulder with the Western world, and I think we are making great strides in it. There is a lot of learning which is happening, and there's a lot of application which is happening. And I think if there is a modality which is available in India, if there is a drug which is available in India, I think we are using it to to as good as probably a Western nation would use it. I think the greater lacunae is more in the research side of it, and I think that's a huge lacunae. And there is at this point also the academia and the industry are not talking to each other. There is a lot of lacunae in the research, the incentivization of research. If I see patients in my clinic, how do I still do a research on the side of it is my daily level problem. It's my daily conversation problem. And I think that's where we as a nation we need to identify our weaknesses and we need to work on them. So, we obviously do get a lot of representative from ICMR. We do get a lot of pharma companies coming to us. I still think that we are decades behind when it comes to research, and I think my that's that probably my aim and my 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 lookout would be that that's where I would like to make a strive, because in a clinical world we are doing fairly okay, and I think our patients outcome is equally good, our management of toxicities, management of disease is equally good, but I think that's where the original research part is where we are lacking. So this is where the gist of it is.
Okay, so thank you so much, sir. Pleasure talking to you and have a nice day, sir.
Thank you so
Thank you,
much.
sir.